Thank you very much for having us. So my question is, we know that the government has invested in several different vaccines to ensure that in the UK we have access to the right ones as soon as it's approved and available. However, with the limited information on the research data that is currently being released, and with the date of the 1st of December to commence this programme being less than 2 weeks away, patients are understandably asking us, are they going to be getting the right vaccine at the initial stage, or should they wait until approval on all the vaccines as things are developing so quickly within a matter of weeks? So this is something that clinicians are finding hard to answer, and the key to success, as I've mentioned, is trust. So data needs to be published, and we need to have clear guidance from NHSC and the government. Do independent SAGE have an opinion on how we address the issue of multiple different vaccinations being available across varying timelines? And do you feel we need some clear communication strategy nationally before we start this programme in December, recognising the risk that delaying the start of the programme will bring as well?
Professor Anthony Costello, I wondered if you'd like to comment on the vaccination programme.
Gosh, I don't think I really am the best person. You know, at the moment, on the data I've seen, I'd probably go for the Dolly Parton vaccine because it's Dolly Parton. But we don't have the data. And the point you make, Vinesh, is extremely important. And to me, it seems incredibly early to be rushing out a mass vaccination program, although we're in a pandemic. And so there is this political push to, you know, do something to try and interrupt, because we have failed so badly with our test and trace system that has led to these soaring peaks compared to the countries that actually put in some proper prevention. So it's a good question. I mean, obviously, to be encouraging, the data of 90+% efficacy on very early findings is encouraging, but it does worry me a bit that rushing into something could lead to a potential disaster if there were to be very serious safety concerns. I haven't seen really any safety data yet. So it is a catch-22. I think December's too early. I think before Christmas is too early. I'm not sure when, does anyone know when the Oxford trial is going to report? Because that's a much bigger study and it's multi-country. And I thought that they were going to be reporting their findings before Christmas.
Yeah,
but
I think
Vinesh, you raised a very good point.
Martin,
well,
you want to come in on this question
well,
as well?
First of all, the difficulty we have here is that the nature of vaccine production is that the companies do have to report for the stock markets to prevent insider trading and all sorts of other things. And then we have to get the papers in the peer-reviewed journals where we can look in more detail. And unfortunately, the reality is there are these two competing objectives. But of course, the portfolios will have to be submitted for approval, and the Pfizer one is being submitted today. So we should, and there has been a rolling review of the evidence anyway, so we should have that fairly soon. The difficulty is that we've got, I think, 148 vaccines in development at the minute, and 12 or so in phase 3 trials. So we can't wait, we would be waiting forever if we were to wait for all of them. Now there's about, of my calculations, about 7 that the UK has already had advanced purchase agreements for, 40 million doses of the Pfizer one, 5 million of the Moderna one, and 100 million of the AstraZeneca. Now, it will take time to scale those up. I have to say I'm rather less concerned than Anthony, because of course there's always a possibility of longer term consequences that we just can't know until time has passed. But remember that tens of thousands of people have been vaccinated already. And the difficulty until we do challenge trials, as is being done with the Janssen study, is that you need to vaccinate an awful lot of people to get even the number of cases we have, which now with the Pfizer case is about 180 cases, which was the pre-specified endpoint for the trial. So it was done absolutely per protocol. That was as agreed in advance as to what we would expect. So yeah, of course, we will need a monitoring and surveillance system, sort of so-called phase 4, to follow up for any consequences. But I am a little bit more relaxed. I think the challenges are going to be the logistics of getting this out, because as Tola has said, it's not the vaccines that save lives, it's the vaccination program.
Thank you, Martin. And sorry, Christina, I apologise if I talked over you. I think you were just saying that you were expecting the results of that Oxford vaccine by Christmas.
Yeah, I was just agreeing with Anthony that I heard Oxford would be reporting by Christmas, end of the year. Yeah.
Thank you.
Sorry for interrupting everyone. I'm jumping.
Fine. So the next question is from Dr. Elizabeth Toberty, also of the Doctors Association. Elizabeth, are you there?
Yes. Can you hear me? Yeah.
Yes, we can. Yeah, go ahead.
So I am also a GP, and we've just touched on the logistics of the vaccine. I've got big concerns over the rollout, the practicalities of the COVID-19 vaccine and our capacity within primary care to deliver it, and that what may be sacrificed is chronic disease management. We're already seeing some excess deaths, mortality, and also morbidity in relation to some of our chronic disease management not being done. I wondered, in terms of the COVID-19 vaccine rollout, does any of one at independent stage share our concerns over that and what is being sacrificed within primary care in order to deliver it, and whether they would have any suggestions on improvements and strategy for the COVID-19 vaccine rollout in order to both provide that service but also protect our patient population from non-COVID causes of death as well.
Thank you very much for that question. Zubaida, I wondered if you wanted to comment on that.
Yes and no. I want to. This isn't about the vaccine as such. I think one of the things I want to say is I feel that our focus on the find, test, trace, isolate, and support program is dissipating. I feel that particularly that the media have also sort of changed their focus onto the vaccine. And I know why we're all focusing on the vaccine. As Anthony Costello has rightly pointed out, it's because the government have spectacularly failed with the find, test, trace and isolate program that everybody is pinning their hopes on the vaccine. But it's not here yet. So I feel that we need to still concentrate on what we know works, and what we know works is the test, trace and isolate program. And going back to Adam's point from the Economist, it's not just about the visible measures, the lockdowns that matter. It's also about the invisible measures. And one of the invisible measures that's wholly failing, that we really need to fix, is the support for self-isolation. There is no point in mass testing or anything else unless we support self-isolation. So I feel we need to go back to that.
Anthony, I know you wanted to come in on that question about vaccines, and then I think we'll move on because I want to squeeze in another couple of questions. Anthony.
Very quickly, in answer to Elizabeth's question about basically about overload of GPs. I mean, GPs have done a fantastic job this year, completely transforming primary care services and, backing up an awful lot of conditions that in previous years would have gone to hospital. And they're understandably nervous about taking on test, trace and isolate, or taking on a whole massive, the biggest immunization program in history. And I share that view, but I think it should be linked in the same way that find, test and trace and isolate would have done much better if they had had primary care people at the table and primary care networks helping with it and with proper financial support helping to deliver it. But I think you're right. You can't just depend upon GPs to deliver all of these vaccines as quickly as we want. I think there is talk of having other centres and also bringing in a lot of retired staff who could help with the vaccination programme, at weekends and evenings and the like. But I think general practice is the backbone of the NHS, and they are the people that should be consulted first about how they're going to do it, and it will be region specific, but they'll need a lot more support.
Thank you very much, Anthony. I'm going to move on to another question